I'm pleased to welcome back to our studios today two nurses from our area. Heidi Roan Stempian is from Benton, and she is an ER nurse, and Ashley Wheel is from Dallas. She also is an ER nurse. They recently took a Nurses Take DC March and Rally effort for safe staffing. They are still continuing their efforts to try to improve the laws in Pennsylvania because there is no law for safe staffing in Pennsylvania, only in California, which I didn't know until these ladies told me this. One of the big concerns you told me, Heidi, is that you're concerned because there is violence because of the staffing numbers.
Yes, so unfortunately, healthcare, nursing has reached one of the top 5 most dangerous professions. This also plays into the safe staffing because a lot of times nurses can be in what we call triage, which is when the patients initially come in by themselves. And there was actually a very serious event that happened in Massachusetts with a nurse named Elise that was attacked and almost killed with a knife. Unfortunately, now she's her life is compromised, but on the upside, the Massachusetts nurses are extremely close to getting their law passed for Massachusetts. But we do not want to wait for a sentinel event like that to happen. We don't want our faces to be the drive to just have this start. So that's why we're trying to hit this before the fire starts.
I guess, is it something, I know you're looking to get something done in Pennsylvania, but is there something that can be done on the national level for all 50 states?
Yes, so there definitely is. Unfortunately, there's a lot of stepping stones that we have to go through, which is why we've been meeting with a lot of our local representatives. We also, when we were in DC, we met with Senator Bob Casey's healthcare legislative aide and the governor as well. A lot of people in just public, the community, they do not realize the issues. They do not realize that on a daily basis, nurses are overtasked, but also that we are attacked, we're threatened, we're verbally abused, physically abused. Our families are threatened. It's an unsafe situation, and it's going to get worse if we don't fix it. Healthcare is broken, and that's why we're trying to fix everything.
I know you told me your entire family is basically involved in nursing, so this is really an issue for your whole family.
It really is. My mother's a nurse, my mother-in-law's a nurse, my husband's a nurse, and my sister's a nurse. So it's safe to say that nursing is a part of me. It's always been a part of me. So trying to make this better for me, but also for the rest of my family and for future generations, because I myself don't have any children, but I know Heidi has a daughter and a son, and if they grow up and want to be nurses, I want to make sure that they're not fighting the same fights 20 years down the road. So we're working really hard to advance the ideas that we've been talking about, safe staffing and violence in healthcare, to prevent future generations from having to come on talk shows and bring this up constantly. We're trying to make sure that a sentinel event doesn't happen again in any other state. I don't want to be the face, I don't want Heidi to be the face of the violence that can happen to you in healthcare.
While these two ladies are very concerned about this matter, they also are proud of the profession they do, and the next time we talk with them, they will talk about the many benefits and why they became a nurse.